All right, well, hello everyone. Thank you for coming to the Thoroughbred Makeover seminars. I am Stephanie Church. I'm editor-in-chief at the Horse Media Group. We publish Off Track Thoroughbred for the Retired Racehorse Project, that quarterly magazine that you see coming. Thank you. This is team right here. Of course, our friend Kristen, also from the RRP, helps us with the magazine, but she is downstairs probably. Anyway, we also publish The Horse, Your Guide to Equine Healthcare, and thehorse.com. We are here today to run the seminars for the RRP. So our first is maintaining performance horses, and Boehringer Ingelheim is our sponsor for this. So thank you very much, Dr. Roos and Boehringer Ingelheim, for sponsoring this session. Our off-track thoroughbreds were professional athletes long before we got them. We want to help them flourish in their new roles by promoting their soundness and being good stewards of their health, both gastric and respiratory, etc. Ultimately, we want them to have long and happy performance horse careers. I'm excited to introduce two veterinarians with a breadth of experience managing all types of horses, but especially off-track thoroughbreds. Dr. Jessica Gould is a field veterinarian at Haggard Equine Medical Group, which is right across the street from the horse park, which is where we're holding this today. Dr. Gould, can you tell us a little bit about your veterinary background and with off-track thoroughbreds?
Hi, good afternoon. Yes, I am a graduate of the Virginia, Maryland School of Veterinary Medicine. I did my internship with Blue Ridge Equine, and following that, I did a second internship with Dr. Duncan Peters, focusing on the sport horse and everything that has to do with horses and showing and maintaining those horses. From there, I worked with a smaller practice for a couple of years until I transitioned over here to Haggard, where I mostly practice sport horse medicine, as well as kind of just your at-home horses as well. And in terms of off-the-track thoroughbreds, they have a special place in my heart. I have one that's leased out in North Carolina doing the hunters and jumpers. And then I have one that's in training at a dressage facility as we speak.
All right, thank you. Dr. Roos, tell us about yourself.
Okay, oh, I do have to get right into this thing. So I'm Sarah Roos. So I do now work for Boehringer Ingelheim. In terms of my veterinary background, I went to vet school at University of Pennsylvania. And then I did an internship in Ocala, Florida. Then I did an internal medicine residency at Texas A&M University. So I'm an internal medicine specialist. I was faculty at University of Florida College of Veterinary Medicine from 2010 until 2016. And then I went to industry, and like I said, I now work for BI. In terms of my off-track thoroughbred background, my first horse was from New Holland. So I've always loved the off-the-track thoroughbred. Full disclosure, and this is embarrassing to admit in this crowd, I currently own a warm blood, but that's only because she was given to me in typical veterinary fashion. She was a patient that once she got better, but the owner was kind of moving on in their jumping career, they gave her to me. But my next horse will definitely be an off-the-track thoroughbred. I've had my eye on a few here.
Mm-hmm. And we won't hold it against you about that warm blood.
I know, I'm sorry. It's embarrassing to admit.
But
exactly. Who's to say no to a free horse, right? Free.
And Dr. Roos has been here all week at the Makeover, helping out with various portions of it.
Yes, we did 385 exams in about 2.5 days, and y'all did a spectacular job having your horses very well prepared. So thank you for that. None of us got kicked.
That's wonderful. All right, so we are excited to be back here in person at the Makeover, and we also have an online audience right now. With the Makeover seminars, we typically have like a category of question, just so we're not jumping all over the place. And we'll be taking questions from both online and in-person participants. If you're online, please ask your questions in the chat, and my colleague Alexandra here will be reviewing and relaying them. And Alex is also a hunter jumper rider in the finals of the Makeover. So we're very proud of her for that. Okay, please stick around till the end also, because we have some door prizes. So today the topics we are going to hit are soundness, gastric health, let's see what else, airway health, vaccinations, biosecurity, pre-purchase exam, expectations, and promoting longevity. So let's start with soundness and lameness. I'm just going to go ahead and get us started here. Be thinking of the questions that you want to ask. What are some of the most common things you each get asked about off-track thoroughbred, soundness, or lameness? Who wants to get us started?
So one of the most common things that I end up discussing with clients with off-the-track thoroughbreds ends up being in relation to the foot health. A lot of these off-the-track thoroughbreds have some downtime right after coming off of the track. Shoes have been pulled. Oftentimes they're shod in a way that leaves their toe long and their heel short, which is not necessarily ideal for what we use these horses for in their after careers. So we have a lot of discussions with the farriers that serve them in these post careers regarding better balance of the foot and better ways to maintain the foot and increase sole depth. A lot of times these horses do tend to have quite thin soles, so we're trying to encourage better sole growth.
What about you, Dr. Roos?
Yeah, I definitely agree with Dr. Gould. Foot is always one of the big things. I think the other questions often come up with, known injuries, some of which maybe have been rehabbed, some of which maybe have not, and kind of what to do with them, and not to jump ahead to the pre-purchase, but I think that's kind of all part of it. So, especially if the horse has a swelling, whether that's, soft tissue swelling or whether that's a big joint, working with your veterinarian to get some imaging of that to see what's going on. So that, okay, is this something that, we can kind of work through? Is this going to be rate limiting? Which that again goes to the expectation, but what is this horse going to do for the rest of his life? If you're just looking for a good trail companion or some low level showing, obviously we can be a lot more of accepting of some injuries versus if you're looking for your next 4-star horse, we may have to kind of reassess some things depending upon some of those injuries that are there, and then kind of what to do with if they have some low grade osteoarthritis. Or again some changes within their joint. We're fortunate now as veterinarians, we have so many things that we can offer in terms of kind of how to keep those joints healthy and happy, everything from systemic therapy to intra-articular. So I think it is kind of identifying those sources of injuries that are actually a problem for the horse, and addressing them.
All right, thank you. Do we have any soundness and lameness questions from the audience yet? Yes. I'm gonna bring you this. Just so the people online can hear you.
You mentioned the long toe and low heel when they come off the track. Is that purely a confirmation thing, or do they believe that somehow it's an advantage in racing to have that?
So oftentimes it's not a conformational thing. Oftentimes it is the way they have been trimmed on the track. And historically, that is kind of how they have been trimmed. We're getting a better understanding of the foot and foot health every day as we do more research. And we have found that there are better ways to provide better mechanics for horses. And that long toe, low heel, especially for the sports we do, whether it be Western, whether it be dressage, jumping, hunter, when we look at that foot, we want them to have a good breakover. So you don't have a very large toe lever that's going to increase the stresses on the foot themselves.
Okay, so we have a question from our live audience online. And Cindy would like to know, when it comes to soundness and maintenance, what is recommended or best practice with supplements? My vet's preference is injection, such as Adequan, and not pellet/powder.
Yes, so that is a great question. And I think, the supplement thing is hard. If we look at supplements as a whole, honestly, whether we're talking joint health, gastric health, any of the categories that we might touch on, I think it is important to remember supplements are not very well regulated. So, to sell a supplement, you do not have to prove safety or efficacy. So kind of my recommendation to people, again, no matter what aspect of health it is that you're looking for, if you're looking at oral supplements, ask them for research. So don't just, believe kind of whatever the marketing tells you. Ask them, do you have published research that shows what this does? I'm not asking for, proprietary ingredients, like I'm going to try and go replicate it, but just, can you show me any sort of evidence that you have that it actually works? And if they can, that's probably more where I'm going to go. In terms of the injectable, the nice thing is, when we're talking really from a injectable standpoint, I would say, stick to the FDA approved injectable, joint health products, which essentially are Adequan and Legend. They really are the only two that have FDA approval, which again is going to tell you that they've gone through safety and efficacy studies. And again, they are actually controlled, versus there are a lot of other compounds out there, some things that are listed as medical devices and whatnot that don't have to prove safety and efficacy. So certainly, obviously, again, full disclosure, I work for BI. We sell Legend. Second full disclosure, I use both Legend and Adequan on my horse. So again, my horse is 20 at this point. So for kind of routine maintenance, I use both of them together. They don't have to be mutually exclusive. But I think really try to stick to things that, again, have evidence, and work with your veterinarian to establish what that evidence is. And like I said, kind of your safest products really are always those that are FDA approved, because they've had to show that they work and that they're safe.
Echoing what Dr. Roos said, I agree with everything she said. And one thing that you can do as the horse owner is not only look for those research papers, but look at the company. Does that company have a PhD equine nutritionist on staff that's formulating these supplements and diets? Do they have a veterinary nutritionist on staff that's formulating these diets and supplements? Because it's one thing to be in your kitchen to come up with something, but it's another to have these very well-educated individuals that are formulating these things and then putting them through the proper channels and research.
All right, thank you. Are there any other questions about soundness or lameness from the room or online right now? Okay. So let's see here. So Kate from our online audience is asking, I'm getting training in horse body work. How do you like to work with body work practitioners when managing lameness, et cetera?
So that's a very good question. And I do work with a lot of individuals that aren't necessarily veterinarians, but provide other modalities in the industry. I don't shy away from recommending individuals that I've worked with and have seen the results, and honestly, a bit of word of mouth from my clients, on, hey, they've had these positive experiences with these other individuals. I don't think that, trying to maintain the soundness of our horse has to be limited to veterinarians themselves. But, I do rely on those individuals to, if they see something that's beyond the scope of what their capacity is, then to reach out to the normal veterinarian that provides lameness services for that client, to say, hey, I think something more is going on, and not get in over their head.
Yeah, I totally agree. I think it all comes down to teamwork and communication. It takes a lot to keep these horses going. I know I personally benefit from my massage therapist on a regular basis. So I certainly would not judge anyone for doing that for the horse either, but I think it's really important to have that, your veterinarian, whatever, whether it's chiropractor, acupuncture, massage, your farrier, I think is all included in that team, that you have to have a good open level of communication so that you're working together. So if you identify a problem, and I'm going to say this as a veterinarian, but probably start with your vet to rule out something that needs, true veterinary drug type, intervention, and then kind of go on from there. But it really does come down to communication and teamwork.
I think Dr. Roos just pointed out maybe the most important thing everybody should think about for their performance horse is having a team. having your team that works well together and is willing to collaborate, because things generally kind of fall through the cracks when one individual is not willing to communicate with the other. So I couldn't agree more.
Are there really any supplements at all that help with thin soles?
So I do find that the biotin supplements certainly can help with sole depth in terms of other particular supplements. And I don't endorse any particular supplement. I'll put that out there right now. But really, they need to have a minimum amount of biotin in the supplement. And I would have to look up that minimum amount. I don't know if you know off the top of your head. But a minimum amount of biotin has been shown to be able to provide assistance with sole growth. Now, that being said, if the horse is already getting that amount of biotin from their feed or other supplements, and you add on additional biotin, you may not see an improvement. So those are all things you have to take into consideration. A lot of our equine diets, when you're using some of the really well formulated ones, provide the basic nutrients that horse should need. So it's all about looking at the ingredients of what you're already providing and, okay, will providing more biotin really help, or is he already getting a sufficient amount? And maybe we need to look further based on the horse's age, other medical factors going on, because all of that can also play a role.
Yeah, I'd say biotin in the supplement of time sometimes, you know, and just really not rushing. That's where I think it is beneficial in some of these horses, you know, especially right as they're coming off the track, to just get some baseline x-rays and see how much sole you're actually working with. Because a lot of those between biotin, maybe they are going to need, you know, shoes or at least to wear boots for some period of time. It doesn't mean that they're going to have to be shot all around for the rest of their life, but giving them some time, you know, to get them on a better nutritional plane, kind of work with your farrier to potentially, you know, shorten up the toe and kind of do some things there that will potentially get their feet to a point that they can be barefoot all around. I think sometimes we try and rush to that point when they don't have the sole depth to do it. So time and patience, two things I don't always have lots of, but should have more of.
Dr. Roos just brought up another really good point. So the balance radiograph, I have to tell you, is a staple of my practice. If I'm doing a purchase examination and everything has looked okay, we're maybe running on a limited budget for the purchase exam, but I need to recommend a certain radiograph, I always recommend doing the balance radiographs of the front feet, because not only does that give you a better understanding of what's going on internally of the foot you're about to purchase on this horse, but it's going to help your farrier on the front end. Your farrier gets a head start, to say, with this new horse, seeing its angles, the sole depth he has to work at. And the one thing to keep in mind is there are a lot of really great farriers, and there are some that, you know, don't really necessarily need the radiographs per se, but at the same point in time, if you get them a head start, I find that most of our farriers want to work with us, and they're like, oh, thanks for these when you get started. So
those could also be post-purchase. So if you've already taken the horse home, it's still don't feel bad getting x-rays. You know, we often joke about the post-purchase exam, you know, that you've brought the horse home and now you call the veterinarian. We all kind of chuckle about it, but it happens, right? And I feel like I keep jumping ahead in your order, Stephanie. I'm sorry.
Oh,
you know, when it comes to the pre-purchase exam and the post-purchase exam, I think sometimes, especially on some of these off-the-track thoroughbreds, depending on where you're getting them from and kind of how much money you're investing in the purchase price, I think sometimes because of time and money, you think, oh, well, I'm not going to do a pre-purchase. Even if you don't do that pre-purchase, still you could do a post, and it doesn't have to be huge. You know, I think sometimes people have it in their heads that, like, if I'm going to commit to doing a pre-purchase, that I'm x-raying all of these joints and doing, you know, a $1,000 to $2,000 workup. And that doesn't always have to be the case. You know, again, work with your veterinarian to say, okay, this is what I want to use this horse for. I want to get some foot films, and, you know, maybe this one carpus looks big. Let's just get some x-rays of it. So you can be selective in those things too. But I think it does kind of just give you that information. Even if, again, you've already fallen in love and you've brought the horse home, you know, it's going to help your farrier and you to kind of know, you know, what to work on going forward.
And I'm one of those people who did the cursory pre-purchase where it was like, okay, if I really like this horse, I'm going to have a vet lined up to come see it. I was in Arkansas for the weekend, and she came out, she looked him over. She's like, well, he retired sound with 51 races. His joints look pretty good. You know what, for what you're going to be doing with him, I'd say he's fine. You don't need to do a bunch of x-rays. So, all right, thanks. I've got a question for you. We recently published a story in The Horse on non-steroidal joint injections. And even limiting it to those options, it was really still a massive topic. And what percentage of off-track thoroughbreds would you say you see joint maintenance? And in the one that needs it, when does that typically begin?
So nobody's going to like this answer, but it depends. So it's the truth though. So there are a lot of factors that go into whether or not we decide to start joint maintenance, and by joint maintenance in regard to this question, joint injections. The one thing I always try and encourage people to remember about these off the track thoroughbreds is they might be 4, but they've had a job. They've used those joints. They've run on those joints. Those joints are not brand new. It's not a horse that has been out in the field and is waiting to be broken. So oftentimes I do find with some of these horses, they do need to have some joint injections sooner rather than later. That being said, that's generally not my first go-to. I generally do recommend, horses get started on whether it's an oral or an injectable supplement first to see how that works. I oftentimes will recommend them use some adjunctive therapies, whether that's massage or chiropractic or acupuncture, to see how they respond to that prior to doing, a more invasive procedure like joint injections. Now, again, that being said, if there's a horse that it has some clear gait deficits due to some arthritic changes, I don't shy away from going ahead and treating that horse's joints, especially if that's going to get them a head start in terms of being able to begin their performance career. So when it's necessary, yes, I will. So, and it really depends on how long the horse raced, what it came out with after it raced, how much jewelry it's really acquired, whether that jewelry actually means something. Some of these guys come out with blemishes and they're really ugly, really ugly. But it doesn't mean all that much in terms of the joint health. So and that is where your vet really does play such a critical role in coming in and taking a look and seeing whether, the discomfort's really justifying going into the joint at that point in time.
Yeah, I totally agree with it depends on all of those things. And I think, again, it's working with your veterinarian to get some imaging on it, see what the actual issue is, and then have the discussion about what's going to be the best thing to put in that joint, because there are now a myriad of things that we can put into joints. It used to be the days of just steroids plus minus some hyaluronic acid. And obviously now we're moving more into having a lot of, what we would classify as, biologics that can have some, good disease modifying effects. So yeah, they're going to make the horse feel better, but they might also help the underlying disease. But we need to know what that disease or what that lesion is, to make the best recommendations of what to put in there. And then it depends, what that horse is going to go on and do. And then I think also a lot of that whole team approach and, getting the horse fit, kind of getting, the rest of everything else comfortable. Because I think that's the thing too. If they have one, off limb, they carry themselves differently. So they start to get, some back pain and some other, muscle type soreness, that we kind of need to get everything evened out so that they can kind of get fit in a new way versus their race fitness.
All right, thank you, ladies. Anyone else on soundness and lameness before we move over to gastric health? Oh, we have one online. So what is your take on a horse that appears sound, but has been pin fired on both front legs? And I have a horse that was also pin fired.
So the pin firing doesn't necessarily scare me off from a horse. Really, I'm going to judge the horse on the way they look that day, on palpation. So if this is the soundness, whether it's the soundness exam, whether it's the baseline musculoskeletal or a purchase examination, I'm going to palpate over those limbs incredibly well, looking at the soft tissues, palpating over the bone, making sure there's no heat, sensitivity, swelling. And if there's nothing in relation to the region that was pin fired, then I'm not generally worried about it.
Okay, thank you. Okay, let's move on to gastric health. So I'm going to get us started with a seed question here. I suspect my off-track thoroughbred who's 8 years old might have ulcers. What are my next steps? Dr. Roos.
I love talking about ulcers. So I spend a lot of time doing it. You know, if you think your horse has ulcers, this again, maybe is not a popular answer, but really try and get the horse scoped. You know, I think 10 years, 5 years ago, maybe even, it was harder to get a gastroscopy done. You know, the equipment itself was quite expensive. So not a lot of veterinarians had it, or they weren't super comfortable with it. So you had to kind of haul somewhere to get your horse scoped. You know, more and more veterinarians now do have portable 3-meter scopes so that they can, you know, come to your farm and do a gastroscopy at home. Or you can haul somewhere if you're more comfortable doing that. But I think it's really, really important to actually see what's in there. And that's true for a couple of reasons. One, if your horse doesn't have ulcers, you're going to save money by not treating something that wasn't there. So if, you know, the horse is acting ulcery, you scope it, the stomach's totally clean, then focus on a lameness exam or focus on other reasons that your horse may be having some behavioral issues or performance issues. When you scope the horse, we also are looking at where exactly the ulcers are. Because again, has anybody here in the room seen a horse scoped before? Good. So a good number of you have. So if you've been there, you've seen horses have 2 different linings to their stomach. So they have kind of the top portion of their stomach is lined with what we call squamous mucosa, which is more similar to skin. The bottom half of their stomach is lined with what we call glandular mucosa, which is what our entire stomachs look like. This is hopefully is not news to anyone. Horses are not well-designed animals. Newsflash. So we don't know why their stomachs are that way, but it's one of the things that set them up for ulcers, and why they are so ulcer prone is they have that squamous mucosa shouldn't be exposed to acid. So that is kind of the classic ulcer. And especially in our racing thoroughbred horse, that's where we very commonly see ulcers, because they kind of splash that acid along their stomach as they're running, especially if they don't have hay in their stomach when they're running. So that's what we kind of expect to see in our thoroughbreds, but they can also get ulcers in that glandular bit. Those ones are a little bit more frustrating, and honestly cause probably more kind of weird clinical signs, kind of weird performance and behavioral type things. And when we see those ulcers in the glandular stomach, we kind of address them a little bit differently in terms of some of our treatment recommendations. So that's where I really do just encourage people to try and start with a scope if you can, you know, and if you can work with your veterinarian, whether they do it or they can refer you somewhere that does it, because then we can really be very specific in how we actually treat them. And ultimately we're going to be a lot more successful with treatment if we can do that.
I definitely agree with Dr. Roos on that. As somebody that practices in the field a lot and gets kind of that complaint or question about, hey, do you think my horse may be a little ulcery? If you can get them scoped, that's ideal because of the difference between the 2 types of ulcers. When I have one with the squamous ulcers, oftentimes they're going to really respond quite well to our typical approach with the 28-day GastroGuard treatment and then rescope to make sure that they are all taken care of. Oftentimes where I see frustrations with clients is when they haven't been scoped, they spend the money on that 28-day treatment and the horse is still acting, you know, the same way it was, which doesn't necessarily mean that the ulcers are gone. it may very well mean that it has this glandular type ulcer in which a different treatment approach is needed. So that's kind of what I would echo on that. In terms of kind of preventing ulcers, as Dr. Roos said, these are grazing animals, and by design, they were meant to have something on their stomach. I think it's about 18 hours a day, so that acid is taken up. So the more time they have to be able to be eating, and obviously eating slowly, hopefully, the better. And in general, if you can provide them with more of a forage-based type diet, that's great. That's the ideal world. Of course, we're living in the performance horse world where, they're requiring a higher plane of nutrition to keep them in the same body condition score. So if we're going to be providing those additional diets, think about trying to break those up into multiple meals if possible. And prior to offering those, make sure they have forage prior. So they have kind of that forage bed that's able to buffer the more acidic type feed that, a lot of our concentrates have.
Totally agree. Always hay first. And I think sometimes that's surprising to people, or not even surprising. It's just something you've never really thought about. 'Cause I'll be honest, like it is easier when you get to the barn in the morning to run down the barn aisle when everybody's, banging at their walls because they're starving for breakfast, to kind of like toss them their grain first and then come back through and hay them. But if you can hay them first, then you do. If you think about the saliva that they make when they're chewing hay, that's their primary buffer. So give them their hay first. They start making that saliva and they kind of get that mat of hay in their stomach. That then when you give them their concentrate, they already have some of that buffering in there. And then, like Dr. Gould said, many of these guys obviously do need concentrate, especially in kind of that transition period when we're trying to, get them in good body weight. Lower starch is better. We do know that that's, higher starch concentrates increase the amount of acid in their stomach as well. So lower starch concentrates are good. Fat is your friend on so many levels. Makes their coats shiny and happy and healthy, but is also a kinder source of calories to their gastrointestinal tract as well. And then, as much as you can, keep forage in front of them. So, nicely now there's all sorts of various slow feeder devices, whatever kind of nibble net type thing you want to do, so that they have to eat their forage slowly. Obviously turnout's ideal, but depending on where you are in the country, you may not have turnout, or your turnout may have no grass. And if you don't have grass and you're feeding them hay while they're turned out, even just kind of making small piles of hay that they have to move around is going to kind of just keep them moving and keep them eating more slowly than kind of one big round bale that they kind of park themselves at and not move around as much.
And of course, in this part of the country where there is too much grass. So we won't get into that problem right now.
Yeah, we have to work hard to find a dry lot in central Kentucky if you're boarding.
I live in Colorado. We have no grass currently. Yeah, so I'll repeat the question.
Awesome, thank you.
So so the question was, an older horse with, I'm assuming, dentition issues, that can't necessarily eat hay. Kind of how do we keep their stomachs happy and healthy when we can't be feeding them long stem hay? It's a great question and a common problem, especially in our older horse. During the summer when they can have grass, great. In the winter when you have to go to all pellets, I think sometimes even having a hay net hung there, assuming he's not going to choke, if he gets little bits of it, I think sometimes that can help because it makes them salivate. Because they're still kind of, as they're working at it, they're still making a little bit more saliva. And then for their primary nutrition, obviously, you're still going to need to go with a pelleted hay. Alfalfa in and of itself, the calcium phosphorus ratio of alfalfa is very kind to your horse's stomach. It's kind of like a Tums. So alfalfa pellets, at least mixed within there. And again, not wanting to get too fat, if we need to mix in some Timothy pellets and some other types of pelleted hay as well. But alfalfa pellets can be helpful. And then, it's easier said than done, but as much as you can divide that into small meals to kind of keep him doing things throughout the day is going to be ideal. Easier said than done. I know some people who have, kind of put some automatic feeders on timers that they kind of drop down during the day. People get very creative and way more technologically savvy than myself. But I do know people who have done some things like that to try and, so you don't have to quit your day job to kind of be dropping hay for them, but as many small meals as you can. And then, anything to kind of increase their salivation will still help.
Yeah, I would echo that. I think if you can spread them out, which, oftentimes if somebody told me to do that in my career right now, it just wouldn't happen. So we do try to understand the limitations of, client schedules and everything. But yes, ideally spreading out would be great. And then they do have hay steamers, and I have no idea the cost on those things, but essentially it kind of kills bad microbacteria and other things, but it softens the hay too. So depending on the severity of dentition issues, that may be an option.
Quick plug for the silent auction from the crowd. There's a hay steamer in there. Should we talk about respiratory health next?
We have one gastric related question. Yes, we'll definitely bring that into our respiratory health conversation. From our live audience online, in the spirit of slow feeding, we have someone who is wondering if there are any ground feeders that you would recommend that are safe and useful for horses for slow feeding.
I'll be honest, I honestly can't think of any of the brands off the top of my head, but there definitely are some, both for turnout as well as stalls and some corner feeders and whatnot that are safe, especially I'm assuming part of the question, worry about horses getting feet caught and things and whatnot in terms of some of the hay nets and whatnot. But there are a variety of ones out there. I just honestly can't think of any of the names of them in this very moment. Yeah. So hay ring. Do you know the name of one?
And this might be taboo, but I wouldn't hesitate to put a muzzle on them and a bunch of hay in the field. So.
Right there with you. I love a grazing muzzle.
You said a minute ago, fat is great for the GI tract. Can you talk about maybe the different oils and which ones might be better for a horse that's prone to ulcers versus others?
Yeah, it's an interesting question. So the only study that was actually done was looking at corn oil in terms of its effects specifically on gastric ulcers. So corn oil was actually shown to decrease the incidence of gastric ulcers and to increase mucosal healing and prostaglandin production, which is good. That study was done back in the early 90s when nobody was really thinking about or talking about the differences in the, omegas and the different types of fats, and nobody's ever repeated it with any of the other oil sources. So I always tell people corn oil is the cheapest. Go to Costco and get yourself a big thing of it. And that is the one that was shown. If for other reasons you're wanting to feed other oils, we assume that they probably have some of the same beneficial effects, but honestly, nobody has repeated the studies looking at them. And even the different oil types, depending upon who you talk to, and I am not a nutritionist, but in talking to a couple of veterinary nutritionists, the omega difference in horses arguably is not as important as the omega difference maybe in people and in some other species. And so, and I know there's a talk later today on some more nutritional focused activities. So they may address it as well, but at least specific to the GI tract, the research that was done with corn oil, 45 to 100 mils twice a day.
I think the other important thing when it comes to oils and fats to take into consideration, because a lot of us are top dressing feeds, making sure that each of these feed buckets is cleaned well afterwards. These products do go rancid. So I do see barns where the buckets aren't cleaned out and there is a nice scum buildup. So just keep that in mind. And then the other thing about your fats is there is a limiting amount that you can put in there before it will become unpalatable for the horse. So if you're unsure of how much your horse really needs, definitely reach out to your veterinarian or even an equine nutritionist.
I recently dealt with the palatability issues in introducing an omega, found one that he liked, so that was good. It's process. So why don't we move into airway health?
Can I real quick give
Sure.
my little plug? So we were talking a little bit even earlier today in terms of gastric health and stress. And I think it is just important, especially in the transition period, but in all horses, honestly, to think about the things that potentially stress them. And it seems sometimes silly to think about some of the things that might stress your horse. Because I think we all think about, okay, like this horse that's, trailering all over Kingdom Come, and showing every weekend. I think we all kind of recognize that that is probably has some degree of stress for certain horses, and some don't seem perturbed by it at all. But I think it is important even just to think about in that transition period, those stressful events for a horse. So horses are really herd bound. And there was actually a really interesting study done several years ago, back in the early 2000s, I think it was, looking at kind of a simulated horse show environment. So they took 10 horses to a horse show, left 10 horses at home, scoped everybody before and after. And of the horses left home, 2 of them developed ulcers because their buddies left. So I think, again, just thinking about kind of the herd environment, if you're kind of constantly mixing and matching who's in the stall next to your horse or who they're turned out with, and that horse is really bound to somebody, and he goes to a show, just trying to kind of keep in mind all of those things. We try to not stress your horse out as veterinarians when we come to do things, but that probably has a little bit of stress. Farrier work, just all of those things that even in your horse that's not actively showing yet, just kind of keep it in mind and try and kind of mitigate those things as much as possible and kind of get your horses used to it. And I have these very snazzy little stress balls here that have this lovely QR code on them. But we actually just recently have been working with a acoustic behavioral musician. The word is currently escaping me. It'll come to me in a second. But actually looking at music as a source of stress relief in animals. And so we actually have a 10-minute clip, which is totally free to anyone who wants to download it on YouTube. That's called Relax Tracks. And it's specifically designed to meet the acoustic needs of a horse. I personally actually also find it really relaxing to listen to, but it is specifically designed for horses to be within the frequency that they like. Horses don't like talk radio. They also don't like rock music. They don't like abrupt tempo and volume changes. And so this is all actually, again, kind of composed specifically to meet those things. And I played it at my barn the other day, and the pony who was getting her mane pulled fell asleep, and she's not normally asleep in the cross ties. So again, just something to try. And anyone who's here can grab the QR code. If you're on the web, then you can even just Google it. And if you just do YouTube relax tracks, you will find it. But again, just play with it. And honestly, provide me feedback because I'm curious to hear how it works for everyone. But I think, again, just all of those things are really important to your horse's stress.
Great, thank you. Does anyone have any more gastric health questions before we move on to airway? And Alex has a microphone she can walk around with too for you. All right, well then let's move into respiratory. I'll get us started. My gelding coughs a couple times at the start of each ride. We call it clearing the cobwebs. Is this something I should be concerned about?
So I think that that's a really good question. And I think honestly, every cough matters. And I think we've all kind of lulled ourselves into, oh, he coughs a couple times and then he never coughs again. But if every time you exercised, you started off with a coughing fit, you would probably think this is not really normal. So I think it is something, if you're consistently noticing, it doesn't mean your horse has a terrible problem, but I think it's worth addressing with your veterinarian. I think sometimes as horse owners, we kind of forget about it because it doesn't seem like an overwhelming health concern. So kind of when you're having your yearly checkup with your vet, you kind of just forget to mention it. But I think it is worth pursuing, at least having your vet, again, kind of, listen to your horse. address your environment. So especially, maybe the horse doesn't do it all summer when you're riding outside, but as soon as you move to the indoor for the winter, the horse starts coughing every time you start. Address that environment. I think sometimes we think so much about our horse's environment in their stall, but not necessarily, the dust associated with the footing that they're exercising on, and that might be triggering part of it. Obviously, again, when we're talking about our, off the track thoroughbreds, they can have a lot of airway issues, both upper and lower airway. And so again, I think it is an important thing to address with your vet, whether that's, looking back and saying, okay, do we know if this horse had an upper airway issue? Did he have a tie back surgery, back when he was still on the racetrack? Has he had some things there that we might need to address? Or again, does he have lower airway issues? So something more like asthma or heaves that, right now is low grade, but if we can address it now while it's low grade, then hopefully it doesn't progress into that, chronic heavy horse for the rest of his life if we can make some environmental changes and do some things early on. So it's not normal for your horse to cough every time you start riding.
I think back to that pony that I grew up riding who would cough every start of every ride. And then we were just like, oh, that's just how she is. So I'm glad we've learned more about that, or we're being educated more about it.
And I do think frequency matters on this. If it's every time, I absolutely concur with Dr. Roos. If you noticed it once and your vet exam just happened to be on the same day, we may just tell you to monitor that. And, if it continues, then come back.
Great, thank you. We have a question from the live audience.
If you know that your horse has had a tie back surgery and may be subject to having some airway problems, do you have a recommendation on how they should be fed? In other words, on the ground versus having the feed at, higher in the stall?
Yeah, that's a great question. So, a horse that's had a tie back, or honestly, a horse really with any sort of respiratory issue. So if again, that your horse has, again, what we're now calling asthma, kind of used to call heaves, feed them on the ground. So there's actually been some studies done, mostly at Purdue University, kind of looking specifically at that, and feeding horses on the ground versus being fed in an elevated hay net, decreased their dust exposure to their lower airway fourfold. And that was in horses with normal upper airway function. So certainly a horse that's had a tie back, where we always are a little bit concerned, could they be aspirating some feed material at the same time? I would definitely try and feed that horse on the ground. That's where then it gets hard, because then we're saying, okay, well, slow feeder devices too, how do you kind of, justify all of it? But I would try and find a safe way to feed that horse on the ground.
I concur.
All right, any other questions about respiratory health from the live audience or online? Do we have one? I'll throw another one in there then. So how common would you say asthma is in the off-track thoroughbred performance horse?
So we were actually just having this discussion before we started. So the numbers that are out there in terms of actual racing thoroughbreds, 80% of them have what we would call mild to moderate asthma. So it's probably a lot higher than the perception has been. And some of that is, again, it's quite mild, and it's recognized only because they need all of their lung function to, kind of do what they're doing. When we then move into the kind of sport and performance horse, the numbers for mild to moderate asthma are kind of probably somewhere, around like 14 to 20%. When we start moving into kind of severe asthma, it's about 15%. But in that transition period, kind of in that, moving from the track to the performance horse, we don't really have great numbers on that. I think, again, it's just one of those things to recognize, if your horse is coughing, if your horse has some exercise intolerance, if your horse is doing anything abnormal, really work with your veterinarian to figure out, is that an upper airway or a lower airway issue? Again, just kind of getting back to the upper airway thing. And that those two things often go hand in hand. So especially if your horse has, or you knew that it had dorsal displacement of the soft palate, or DDSP, that is often correlated with asthma. So some of the things that happen in their upper airway kind of change the mechanics and the pressure and whatnot in their lower airways and kind of set them up for each other. So I think it is just one of those things to just keep in the back of your mind and keep on your radar that, again, especially if your horse, kind of specific to the transitioning thoroughbred, like, that he was racing, so clearly he was fit, and now you're trying to like leg him up to do whatever you want to do with him, and he just doesn't seem to be able to maintain fitness. Talk to your veterinarian about that and assess those airways, because that could be part of your problem.
Coming from where I do look at most of the off the track, so post their careers on the track, I would say my percentages are smaller with kind of the moderate to severe. And I'm not really sure why that is, whether that is because the ones that have severe really have been completely retired. And I do think maybe what shows up is dependent on the client that has the animal and what they kind of share with me and what I observe in, their regular health exams. But I would say it's a bit lower, and I don't often send horses to the clinic for BALs I will when I need to, but it's a little bit lower than I think I even would have expected, especially after talking to Dr. Roos when we started this today. So I think it's interesting.
And I think some of that probably also does go to the expectations and what the horse is doing. So again, if you're transitioning your horse to being kind of a low level hunter, you can, I don't want to say get away with, but they could have some underlying lower respiratory issues that you're just never honestly going to run into a problem with. Versus again, if you're taking that horse and trying to make it your 4-star horse, it's going to have potentially some more issues relative to not having its full kind of lung capacity. And then obviously it also is depending on what age we're looking at, because in general, kind of what we would classify as a severe asthma, we're never really seen before they're 7, 8, 9 years old at the youngest. So again, if you're kind of getting that horse more in its 4 or 5-year-old range, it certainly isn't there yet, versus maybe that war horse that is a little bit older coming off, is at least now fitting the age category for maybe having more severe disease. Doesn't mean he has it, but just kind of changes how relevant it is in our head, depending a little bit on the age of the horse as well.
All right, we have a few questions from our online audience. Going back to, we were talking about steamers earlier. For some of us, that's out of our budget. And how about wetting grainer hay? Is that an option?
Absolutely. So in terms of respiratory disease and health, so especially if your horse is known to have respiratory disease, then dry hay, unfortunately, is kind of your enemy. Round bales, the worst. So kind of the hierarchy I always go through is, if the horse has respiratory disease, I'm going to kind of veto the round bale. Now, again, totally recognize if for cost and availability issues, you have to buy a round bale. Again, I live in Colorado, totally fine. Just don't put the round bale in the field with the horse, kind of put the round bale in an empty stall or in a shed somewhere and just kind of pitchfork hay off of it. Because the problem with the round bale is, they bury their head in the middle of it. It's kind of dusty and moldy in the middle of it. And then they're just inhaling as they eat. It's kind of like me in a bag of potato chips. So we want to get rid of the round bale. Then going to dry hay, unfortunately, again, we do know that the respirable particle, so kind of what they can actually inhale into their lower airways, is quite high in dry hay. So going to wetting it would be kind of my next step. Now, when we say wetting, again, you really need to soak it for at least 10 minutes. And kind of what I often tell people to do is, you also want to, especially if you're feeding alfalfa or kind of a more densely packed flake of hay, is you don't even just want to kind of dump the whole flake of hay into it, because the middle of it won't get damp. So I kind of take my hay and I'll often put it in a hay net, kind of fluff it up in the hay net, and have one muck bucket that's dedicated just to soaking hay, so that it's, clean. You're not putting poop in there ever. And have that muck bucket that I then take my hay net with my kind of fluffed up hay, and put it in that water. For dust purposes, you want to soak it bare minimum 10 minutes. If you're soaking it to get rid of sugar because you also have some insulin metabolic issues, then we're soaking it for at least an hour. But for dust mitigation really at least 10 minutes. So kind of just, sprinkling the hose over it, unfortunately, is not going to be enough to really get rid of the dust. So if you have it in that hay net, the thing that's nice is then, you soak it for your 10 minutes, then you can pull it out. Now, again, I'm going to tell you to then feed it on the ground because we want the horse's head down to still minimize, how much it could actually inhale. So whether obviously, again, there's safety concerns sometimes with hay nets on the ground. So then just dump it out of your hay net onto the ground and feed that way. And then if you can afford a steamer or want to do steaming, then the hay steamers are a very good source as well. The one thing that people are starting to look at a little bit more that here in the United States has never been a popular horse feed is Haylage. So anybody who's ever spent time, in the UK, they feed a lot of Haylage there to their horses, and horses do great on it. And it's just something that we in US for a variety of reasons haven't done as much with. But again, the group at Purdue that's doing a lot of research on it has some really good evidence that, Haylage is really good for your horse's lower respiratory tract. You just want to make sure that you handle it appropriately. And I do always advise, if you're going to feed Haylage, to also have the horse up to date on its botulism vaccine, because that is the one potential risk of feeding Haylage. I think the steamers, there is that upfront investment unless you get it in the silent auction. I'm giving you a plug, Jen. There is the upfront investment of the hay steamer, but I will say, especially in cold environments, such as this can be in the middle of winter, soaking hay, it's fun for like the first 3 days in July when you also feel good getting wet, and then it is a pain in the bum. So that is where the hay steamers are nice, because you're not dealing with freezing water and whatnot if you are somewhere that it gets really cold.
So my question that Stephen was, because you just said it's probably what is hay?
So haylage is essentially fermented hay. So haylage or silage. So like here, if you have dairy cattle, they eat a lot of haylage and silage. But again, because of it, it is nice and damp. What sort of Brit are you?
Okay, so did you have something to say?
Oh, I was just going to echo what Dr. Ruth said in terms of just making sure that that timing is so important for whether or not you have a metabolic horse or not. So pay attention to the time that you're soaking.
Okay,
and certainly if you are soaking longer, so either if it's just kind of your routine is to soak longer, even if you don't have metabolic, or your horse doesn't have metabolic disease, if again, kind of just your barn routine means that you end up soaking your hay for an hour, or you're purposely soaking your hay for an hour because your horse has lower respiratory disease and metabolic disease. If you're soaking it for an hour, do make sure that your horse is definitely getting a vitamin mineral supplement, because you will start to leach out some of those vitamins and minerals if you're soaking for an hour.
And you want to dump that wastewater too and not let them drink it.
Yes.
Right.
It is sugar water otherwise.
Okay, thank you. We have another question from our live audience online. If a mild left side larynx laziness is found on a scope, what signs would you recommend the rider or owner watch for to assess if it has progressed?
So the best way to assess if it's progressed is actually to have that upper airway scope. That's really the only way besides increased noise during exercise. So that would be something that your normal veterinarian could provide and bring out that scope. It's a fairly quick procedure. They don't love it because we can't sedate them for it. So we do generally have to twitch them for it. But it's relatively quick, and we can then assess whether it's worsened.
Yeah, we were talking earlier, the other thing that, again, some vets have and is becoming a little bit more is what's called a dynamic scope. So some of you may have seen this, where they can actually, have the scope on them while exercising. And if you're really, really worried about that, is going to give you and your veterinarian the best information. And again, it's not something everyone has. You'd have to work with your vet to kind of find out who has one and kind of how to get it done. But the benefit of being able to scope them while they're exercising is, some of those upper airway things are affected by head carriage. And that's hard to kind of replicate, even in the days that all we had were treadmills, to try and put a horse in a frame and kind of see what their throat does, and some degree of collection can be really hard. And, more and more as the dynamic scopes are becoming more common, there are more and more studies kind of showing, what we see at rest is not always what we see when they're actually moving. So some of the throats that, kind of look pretty bad at rest are honestly pretty functional at exercise. So you won't see those signs in your horse, which is good. You know, it means it's not something you have to be super worried about. But I think if you are hearing that noise or you're having, you know, some exercise intolerance or, you know, cough at exercise and those sorts of things, really working with your vet to scope that horse and see kind of what's happening. And ideally, if you can get them scoped at exercise, that's going to be the best.
We have a question from our live audience from the executive director.
Thank you, Stephanie. So I know in like yearlings, for example, you can do acupuncture if they have kind of like a tubey throat or something like what we were talking about to try to wake it up a little bit more and try to help that. Can you do that in a fully mature adult horse, or when does that start becoming less effective as a treatment modality?
So you bring up a really good point, and that's something we actually use frequently at Hagyard. We have quite a few veterinarians that are certified in acupuncture, myself included. Now, myself included, I do not see that population of horses all that often, but I would say the longer that the paralysis has been there, the less likely it's going to have a great effect. Could it help a little bit? I think so, because the nice thing about acupuncture is it really doesn't hurt. But I think that we should not count on it as a miracle worker for an older horse where it's been there for a long time. So keep our expectations realistic.
Do we have it? Oh, we have one airway question.
So there have been some studies using acupuncture to help with that, and there have been some pretty good results. I don't think it's ever cured any completely of it, but it's definitely helped when it's been addressed at a younger age. So I don't think that we could ever say they really grow out of that. I do not know. I would have to ask somebody that actually does that a little bit more frequently on the younger population. So usually my population of horses, we're going to be looking at more 3 and up.
Yeah. And I think there are more studies following some of those horses that honestly, whether you do anything or not, can kind of grow out of it. So the repeatability of some of the upper airway scoping can change over time. And then, like I said, what you see at rest versus what you see at exercise, there's also more and more evidence showing there's not always a great correlation. So I think, you know, not to undermine still scoping them, you know, as yearlings and as youngsters, kind of see what you're working with. But I think so much of it is, you know, function and kind of, are you seeing actual problems related to what you're seeing to know kind of how aggressive you need to be. Yeah, especially now, like I said, with having more ability to do those dynamic scopes and to really see what horses are doing actually at exercise is really kind of changing the way that we can think about a lot of those things and really see what's actually happening.
And I think they've done a couple of studies where they actually compared, they showed videos of scopes to different doctors, and they blinded the doctors to which horses they were, and the results of the grading was different each time they saw the same horse. So I think kind of repeatability can be an issue as well.
Let me think on that. I can't think of anything that kind of summarizes all of it. A lot of it right now are kind of separate research articles on different things, but let me think on it. You're welcome.
And we've run a few news stories on dynamic endoscopy studies based with that method. So thehorse.com, maybe search that term.
And I will say, and thehorse.com does do an excellent job when they cover those things of referencing, you know, the original research article too. So if you're a nerd like myself and like to read the original research, a lot of times they'll even reference it in there. So that's a great source to start with.
Yeah, thank you. I'm going to Do we have any more questions about airways before we head another direction? Okay, let's talk about vaccinations and biosecurity. So
I think I just saw everyone in the room fall asleep.
so we need to prevent diseases in our off-track thoroughbreds. I know that there were some requirements for those competing here at the Makeover, and there are often requirements at other types of shows. Can you explain a little bit about the timing of vaccination requirements before events and why they're there?
I got the short straw. So yeah, so I think, vaccines are funny because I feel like there's something everyone's talking about much more these days than they've ever talked about ever. So in terms of our horses, obviously, there's the vaccines that we do for all of the mosquito-borne diseases or environmental diseases. So those would be your tetanus, Triple-E, West Nile. That again, depending upon kind of where you live, the frequency may vary a little bit. Certainly again, when I practiced in Florida, those sorts of vaccines I was giving 2 to 3 times a year because the mosquitoes never went away. Versus if you are in areas that freeze, that might be a little bit different. Obviously, the ones that are more specific to our traveling showing horses and that are often a little bit dictated by venues and organizations are going to be the flu and the herpes. I think when we talk about flu vaccines, think about your horse's flu vaccine honestly the same way you think about your own flu vaccine, which is strain updates and kind of what population they are. And so again, kind of talking to your veterinarian about what flu vaccine they're using and making sure that they are current relevant strains that those vaccines are based upon. And then again, frequency for those will depend a little bit upon, again, kind of how frequently, you're traveling and whatnot. But most of those are generally going to be twice a year, but certainly can be more frequent. The herpes vaccine question, I think, is the one that comes up a lot because, again, certain, disciplines and venues and whatnot have their requirements. Specifically, I know for this event, so for the Retired Racehorse Project, we said that it had to be more than 14 days, but less than 6 months. And I think, some of the question was, well, why does it have to be more than 14 days? Some of that is it takes time to generate an immune response. So if you vaccinate your horse against anything as you're putting them onto the trailer, you're not giving them a chance to actually mount a response to that. So it's not going to be protective. And if anything, sometimes makes it more confusing because it is not abnormal for a horse to get a little bit of a low-grade fever after being vaccinated and be a little bit sore, be a little bit puny, kind of like us, right? Everybody in here, when you've gotten your flu vaccine or a COVID vaccine or any sort of other vaccine, your arm may be a little bit sore. You may feel a little bit off for a day or two, and that's to some extent to be expected. It just means your immune system is responding and doing something. So if we vaccinate a horse the same day we take it to a horse show, and now it has a temp of 101.7, does that mean he's having a vaccine reaction, or does that mean, oh God, he's actually having a clinical problem and disease? So that's a little bit where the, it needs to be more than 14 days beforehand, is to give him a chance to respond and to remove that complicating factor in our heads about, is this a disease or is this, the vaccine in terms of why a horse may have an issue. And then, outwards of 6 months is essentially going by, again, labels of the vaccines and how long we hope that they're providing some degree of protection. But I think kind of, the other half of your title for this talk is the biosecurity. And I think, I can't talk about anything about a vaccine without also saying like the biosecurity portion of it is huge too. And so, also doing everything you can to just maximize your horse's overall health so that they have a chance to respond to whatever vaccine it is appropriately. So that's, nutrition, stress, all of those sorts of things, deworming, so that they can mount appropriate responses to their vaccines, and then doing everything in your power to, decrease how much they're being exposed to different things, which is obviously easier said than done when you're in a new environment with a lot of different horses. But at least, not sharing twitches, not sharing tack, don't let your horse drink out of communal water sources, all of those things, so that at least we're not asking their immune system to do more than it absolutely has to.
And I think that the timing is so important too, because the last thing, so I've acted as the show vet at multiple venues, and the last thing you want to do, or I want to do, is put your horse into isolation because it popped a fever in response to the vaccine that it was given, and that there's not an actual problem going on. It's a very natural response. And then you're very excited for your show. And I'm about to make you very unexcited about said show. Then in terms of that biosecurity, the other things, we oftentimes, when we're going to these shows, we're seeing our friends, and sometimes they are from close facilities, and sometimes they're from faraway facilities. And we often go and pet their horses and put our hands all over their horses. And then we walk back to our barn. And then we pet our own horses. So those are things to be thinking about. And as hard as COVID has been, it's been a little bit eye-opening. And when people ask me now about how to better their biosecurity at these shows, I'm like, treat it like we've been treating COVID, use that hand sanitizer between even your own horses, just to make sure, or if you have gloves around the barn, do that, whatever's going to keep your horses safest, separate grooming boxes. And again, just to re-echo Dr. Roos's, no sharing lead ropes with outside barns, no sharing tack with outside barns. So all of those little things really can add up.
On reference to your biosecurity, like we're from Virginia, so Maryland got, obviously with social media, you hear about everything, and Maryland had active cases of herpes and so forth, and we chose not to even show. If we go to a show and then once we're there, we find out, not necessarily at the show, but in the general area. So obviously you don't know who's coming in and what their vaccination process is. Is there something that we can treat the stalls? Because we get exposed to some of the stalls are concrete, some of the stalls are wood. Is there something that we can spray on the walls as a biosecurity prior to putting our horses into the stalls?
So that's a really hard one because of the different show locations. And I'm originally from Virginia, so I can definitely appreciate some of the older facilities they have there, like even Keswick with all the wooden stalls and Deep Run. So unfortunately with wood, it is very difficult to disinfect wood. There are so many crevices, and it's really not all that possible. Time is what's in your favor. Time. So usually, I don't know what you recommend, Dr. Roos, but 7 to 14 days sitting is the best thing to do. Now, is that always possible? No. And so that's the unfortunate part. They do make certain virucidal and bactericidal products that you can use on things like, the painted concrete. So the concrete that has that lacquer on it that allows you to disinfect. So there are those certain products out there. I think the most important thing about those is that they are left on the walls for a long enough period of time. And usually each of those products is going to have those guidelines on the actual product label, and then thoroughly rinsed off so that your horses aren't exposed to that product. And the reason why I say that, and a good example, so when my sick dog, my husband tried to clean out his kennel because it was really gross and used like straight bleach and then didn't wipe after, and she got a chemical burn on her poor little lips. So just always make sure that you're coming back behind and getting some of those products removed, because they can, they can cause chemical burns. So I think make sure that you're bringing in, brand new bedding, brand new hay. Don't use anything that was left over in there. I don't have any product names offhand that I can recommend, but making sure you can get anything there that, can be wiped off, anything metal in there, wipe it down if you can. Those are kind of my best, because it is unfortunate. We don't let these properties that have things like wood that makes our stalls or unpainted concrete rest long enough for a lot of, these viruses and bacteria to die off. So that's the hard truth behind, rapidly having one show after another.
Yeah, I think the important thing is to remember any of those cleaning products are inactivated by organic material. So you need to start with a clean stall. So you have to get rid of any manure, any straw, any hay, anything organic. Get rid of it first. And I still always tell people, still wipe the wood. I agree. Like it's not going to be as effective as a painted concrete surface, but every little bit helps. I think the easiest for most people is to do a 1 to 10 bleach dilution. It's going to get a good amount of it, especially again, but it is so important to get rid of the organic material first. And then you can either do a 1 to 10 bleach or a 1 to 4 accelerated glutaraldehyde. Excel is one that I've used a lot to wipe down whatever surfaces you can wipe down. The other thing is even just keeping in mind, then when you get home, so let's say again, so you're at a horse show, there's not, like a big herpes, like quarantine outbreak, but either you're just nervous or you hear kind of, some rumblings, that there may have been some sick horses there. When you get home, and this is again, sometimes easier said than done, if you can keep whatever population of horses you just brought home kind of separate from everyone else, 21 days is ideal. Obviously that's not always practical because you may be going somewhere next weekend. But if you can kind of keep, whoever's been away separate from everyone else, then God forbid, 2 days from now, you get a phone call. Oh my God, that, there was a neurologic herpes case there. You've at least now kind of already started your process, but it will just make it easier the more separate populations you can keep. And even really, like I said, kind of separating like your traveling showing population from your resident population. So again, if you have a big barn where maybe you have a couple of brood mares and you also have your performance horses, the more you can keep your traveling population separate, then at least God forbid there is any sort of disease outbreak, you kind of only have one group of horses you have to deal with, not your entire farm to deal with.
That was the term I was searching for, organic material. It's like on the tip of my tongue.
Move the poop. Yeah, so the question was, essentially, if you come in with a well-vaccinated horse, kind of how comfortable can you be? I still would try and clean for a couple of reasons. Every horse responds to vaccines differently. So sometimes you get one horse that's just not a good responder. Maybe that horse has, equine Cushing's disease or, has some other reasons that he didn't respond great. And there's other things out there, even other than the things that we can vaccinate for. So I kind of, and what is it? An ounce of prevention is worth a pound of cure. I think I just butchered that.
No, that was right.
Yes. So I think it does take a little bit of time and effort, but I think bare minimum, like I said, making sure that everything is out. And I do like to at least do kind of a bleach wipe down if I can, just to make myself sleep better at night.
And I would encourage you guys to if you go to thehorse.com and you search biosecurity for show horses, we have a pretty good article there. We have other biosecurity resources, like an infographic there too on the horse. Something good to read up on. Thank you. So this is your 6-minute warning. So any questions? We've already talked about pre-purchase exams some earlier. I had promoting longevity on my list, but I'd like to give everyone an opportunity to ask whatever question they would like about maintaining performance horses.
I just thought about one last biosecurity thing.
Sure.
So some of my own clients, so if you're worried about the biosecurity of, there are a lot of people at these shows that come around, and some of which aren't even horse people. Some are just, especially here at the Kentucky Horse Park, where, we get a lot of visitors from everywhere. So it never hurts to put a sign up on your horse's stall that says, "Please do not touch me, I bite." So I know that seems a little severe, but I've had some clients do it. And I think that, little things like that can really protect them overall, because you're not having strangers sticking their fingers through the stalls and, wanting to pet a horse for the first time. So I think it also, has a little bit of a, protects you. So just something a little extra there. I know that sounds a little severe.
Do we have any more questions from the audience right now? I will ask you one. So my first off-track thoroughbred, Icy, he lived to be 30, and my sister and I were able to ride him well into his 20s. I'm hoping for that same kind of longevity with Happy, my current horse. What are some tips?
So I think the biggest thing, especially if you want them to be a performance horse, and we're going to disregard level at this point. So just even if it's just your trail riding horse, you guys, I think the biggest thing is making sure your vet gets out there for either what we would consider a wellness examination or even a musculoskeletal examination. So where we're not looking for lameness on that day, but we're going over the horse. We're looking for little aches and pains or little swellings and bumps that may be new from the last 6 months to see, okay, well, is this now affecting my horse in a negative way with its performance? And that's something that I've really started to recommend to all my clients, all my pre-purchase buyers that, want to know what they can do for their horse. And just having your vet come and look over the horse twice a year, put their hands all over it, see, okay, is this bugging the horse now? Is it not? And letting that guide us in what kind of either prophylactic or just baseline treatments they need moving forward.
Yeah, I 110% agree with that statement. I think, it's something that just hasn't always been top of mind for horses. I think, we all think about that with our dogs, right? You go to the veterinarian, especially with your older dogs, maybe even get blood work every 6 months to a year, especially if they're on chronic non-steroidals or anything like that. And I think we do need to think about our horses that way. Our horses happily are living much longer. So really working with your veterinarian to do that exam, to talk about, okay, has this horse either been on any sort of medications that make us think we should do some blood work? Is he starting to show some signs of, metabolic disease or of PPID? He's not shedding out as well, or he's not maintaining muscle, and really proactively getting on top of those things, I think is super helpful to kind of keep them overall healthy. And then, really keeping up with, nutrition and appropriate body condition and appropriate fitness is also going to be really helpful. Much like all of us, if we can, keep some level of mobility and movement on a day-to-day basis, I think that's super helpful for keeping them healthy and happy long-term at whatever performance level that might be.
And this kind of bounces back to joint health as well. I find that, we used to think about if a horse needed a joint injection, okay, well, that's it. All right, it got its hocks done. April of 2020, April 2021 rolls around, time for its hocks again. I'm really trying to, encourage my clients to think about it in a different way now. And instead of thinking that they necessarily have to have their hocks done once a year, let's have the vet look at this horse twice a year. Let's see what's actually bothering the horse if we can, because it may not be the hocks anymore. It may be a different region of the body that's bothering this horse. And when we kind of put them on this routine schedule, which is trying to get people away from using, oh, it's time for his routine hock injections. Let's think of it more as, okay, does he need maintenance in the first place? There are a lot of horses that go out and I do these musculoskeletal exams and they're looking really good. I don't recommend that they get anything injected. And I think that's an okay thing. And I think that's money well spent, because then you're not using, a voluntary procedure that does have the potential for complication that the horse doesn't need. So I really encourage you guys to think on that a little bit and maybe start moving away from the idea of routine injections.
We have time for one last question.
I think that's a very good question. And I do think, there's that old saying, what's the saying? Like you stop and I don't think it's you stop and you die, but it's something to that nature.
Harsh but true.
Harsh but true.
A body in motion stays in motion.
That's what I was searching for. That's the one. But in general, yes, I agree. These older type horses, we don't want them to sit in a stall, and just stop moving. That's definitely going to be worse for them overall. And if he does have some muscle wasting, that would be something that I definitely bring up with your veterinarian. There are a lot of reasons for muscle wasting in an older horse, be it, potentially a Cushing's or PPID issue. Yep. And be it maybe that there is some even neural deficit that's causing that wasting. So I don't think you're doing a disservice. I think that one of the things I would think about is kind of listen to what he's telling you. If you ask him to move forward one day when you're in the saddle and he's just absolutely refusing, I think take that as a sign that, okay, maybe he is ready to stop and just listen to what he's telling you. Listen to those small cues. I find oftentimes it's when we don't listen that we end up, sorry, we didn't stop sooner.
Yeah, I totally agree. I think, turnout is great because they'll pick their own poison. But they do. If we listen to them, they tell us a lot. Sometimes we just have to get off our own schedules and our own perceptions and listen to them. But yeah, if they're happy and their, ears are forward and they're, trotting out, great. They're ready to go and that's the best thing for them. But kind of have that little thing in the back of your mind of, when he kind of says no, okay, let's look into that a little bit more.
Well, we are out of time for this particular seminar. Thank you so much, Dr. Gould and Dr. Roos, for sharing your time with us and your wisdom and your expertise.
Thank you for having us.
Thank you so much.
And thank you also to Boehringer Ingelheim for your generous sponsorship of this seminar. Now we're going to do some door prizes.
Yay, door prizes. There is also on the table back there, there is some other various handouts and whatnot on several of the different things that we talked about, but also some lovely GastroGuard and UlcerGuard grooming towels with their little golf holder. They fit on your belt very well, and some pens and some other things. So, and as well as your QR code to get to my musical track, which I encourage you all to try because I find it fascinating.
Thank you. So, Julia, is it time? There's one behind you. There's one behind you, Julia. Dr. Gould's going to do the honors. Joanne Walton. All right. Well, you are dismissed. Thank you very much. Please stick around for our next one. Okay. I'm ready.